As public officials and experts have grappled with closing businesses and regulating public gatherings, a dominant narrative has emerged that COVID-19 has spread due to urban density, large public gatherings, and private behavior. These explanations are inconsistent with several patterns and surges. Recent analysis of 1.5 million CDC records of COVID tests found that during the period of stay-at-home orders, COVID rates fell for all groups except for Latinos, whose rates surged the whole time during stay-at-home. The CDC data also suggests that COVID-19 transmission in suburban and rural regions sometimes outstrips that in densely populated urban cores. And so the recent outbreaks of COVID-19 among California farm workers in counties such as Imperial County, what we're talking about today, or other places like Oxnard or Hanford, illuminate the central role of the workplace in COVID-19 transmission in rural and suburban geographies. In our report, in our brief, we examined the relationship between the percentage of households in a county in which people worked and lived below a living wage. Our analysis looked at the relationship between the percentage of households in a county that had workers and lived below a living wage, and COVID positivity test rates. And we found a strong relationship between low wage work and COVID-19 positivity. We also identified the industries that have the greatest prevalence of low wage workers and the likelihood of federal paid sick leave by the industry of workers, based on the exemptions that exist in the bill. And so our main findings were that, first off, 18 of California's 58 counties, as of a couple of days ago, had COVID-19 positive test rates above 8%. Right, the state set certain thresholds for opening local economies back up, and one of the stipulations was that positivity rates need to be below 8%. As of July 8th, California had 18 counties that had positivity rates above 8%. And what we found was a striking relationship between what we called county level worker distress, which is the percentage of households working and making less than a living wage and living in households that were larger than the state average. So we found a relationship between worker distress and positivity rates. Most counties that were above the state average, with worker households making less than a living wage and the size of the household, most counties that were larger than the state in those two measures, what we're finding is that there's a relationship between worker distress and COVID positivity that's constant across rural, suburban, and urban geographies. One of the other things we looked at was the percentage of worker households making less than a living wage by industry. So we identified some industries in which worker distress would be highest. Agriculture was at the top of the list, followed by accommodations and food services, administrative and support and waste management, transportation and warehousing, and retail. So our recommendations are reporting COVID-19 positivity by industry, so that we can understand how industry's trends affect COVID transmission, and so that our policy can play a critical role in developing appropriate workplace health and safety standards. The guidelines for reducing COVID transmission were developed in a way that applies largely to middle-class people that can afford to stay home from work, that can afford to miss work. There are certain sectors of the economy that will continue to run regardless. We eat every day, and that food comes from somewhere. And so if we're failing to address where it is that COVID was surging during the entire time of stay-at-home orders, then the problem is not going to go away when we have stay-at-home orders. It's going to continue to spread in ways that confound the experts who are trying to give us guidance on how to reduce the spread of COVID.